Welcome to Know Your Body. I'm Dr. Andrew Wong, alongside our Director of Functional Nutrition at Capital Integrative Health, Araceli Benavides. At our practice, CIH, or Capital Integrative Health, we take a deep dive into understanding your body and giving you actionable steps to organically give you the healthy life you deserve. So today, let's discuss blood sugar and how balancing blood sugar and regulating blood sugar is essential to optimizing your health. So Araceli, as a functional nutritionist, I know you deal a lot with patients and you probably have your own personal stories as well about blood sugar regulation and how that's really up-leveled your health. So let's talk about what blood sugar or blood glucose is first and how it serves as the primary source of energy for the body cells.
Yes, absolutely. This is something that we address very often with our patients. It can really optimize health for anyone. It doesn't matter if you don't have prediabetes or you don't have diabetes. This is still a very important topic for you to address to have optimized health. So basically, blood sugar is something our body want to regulate very tightly. Our body doesn't like to have too much blood sugar or too high blood sugar or too low. And our body has the ability to compensate for this. If our blood sugar is dropping too low, our body's going to release blood sugar from our muscles, from our liver to keep it stable. And on the other hand, if we're eating too much and our blood sugar is going too high, that's also very inflammatory for our body, inflammatory for our cells. And our body wants to take that blood sugar into our cells to either burn it as energy, or if we have too much, it's going to eventually convert it into fat and increase fat storage, which of course we know that can lead to weight gain, which a lot of people want to either address it or work on weight management. So definitely an important thing to keep control if you're looking to optimize your metabolic health.
And just to make sure the listeners are on the same page here, we're talking about blood sugar. Glucose is sugar. It's a type of sugar. It's the main source of our body's, energy, as you said. And, how is blood glucose or blood sugar levels measured? And what is the normal range of blood sugar?
Yeah, so well, we have different ways to measure blood glucose in our blood, basically. And so we can do either labs to check our fasting glucose. We also like to check in functional medicine our fasting insulin, which is the hormone that helps to regulate blood sugar. And we also have the marker that is the hemoglobin A1C to have a summary of the 3 months of blood sugar regulations. So what we like to recommend our patients, especially if there's some blood sugar dysregulations, is to maybe consider getting a continuous glucose monitor that will tell us and be able to read what the blood sugar is doing throughout the whole day and night and see how it's fluctuating throughout the day. So basically, in functional medicine, we use ranges that are a little different than what conventional medicine looks at. And we like to use optimal ranges for the health. So we like to see the fasting blood sugar at 70 to 90 if things are working well. And then we recommend that after we eat, to not have a spike bigger than 30 points. So maybe if your baseline was 90 and then you ate, try not to spike more than 120 to prevent that glucose spike that is going to cause further dysregulation of hormones and more inflammation in your system. So that's something we can only track if we have a continuous glucose monitor, but definitely would be something interesting to consider with your healthcare provider if you do have blood sugar dysregulation.
And blood sugar, like you said, can be measured by the CGM's continuous glucose monitors. I think for people that either don't have access to that or can't afford it for whatever reason, because a lot of times they're covered by insurance, let's say if they have diabetes and they're on insulin and things like that, but a lot of people do use it to try to optimize their health as well. The other way, which is kind of the kind of cheap biohacker way to check blood sugar, is do you feel a sugar rush when you eat sugar? So if you eat too much, if you eat let's say too much types of foods which we can talk about in a minute, too much types of foods that would spike your blood sugar, then you'll get a sugar rush. That's kind of what non-scientifically we call brain fog or kind of food coma and things like that.
Yeah.
How many people have felt that?
Absolutely. When our blood sugar goes really high fast, then our body's going to try to compensate for that and bring it down also fast. And that's when we start to feel sleepy, we feel off, we feel more fatigue after we eat, after we just ate. And then we start to feel hungry very fast. Maybe you ate 30 minutes ago or an hour ago, and then you're already feeling hungry and wanting to eat again. And this is not normal. We should be able to stay at least 3 hours in between our meals without having to eat again. So maybe if you are experiencing that you feel like constantly hungry or that you're getting like hungry too fast after you ate, maybe blood sugar regulation is something we can adjust.
Kind of like a sugar roller coaster. I don't know about you, but I don't really like roller coasters that much.
Yeah,
How about you?
no.
So we can have a really nice, we're really giddy and really have almost like a frenetic energy with too much blood sugar. And then, like you said, as the pancreas secretes more insulin, that blood sugar drops. And you'll get quote unquote hypoglycemic or low blood sugar, feelings of fatigue, lethargy, dizziness again. Um, so we talked a little bit about the why of, why someone has blood sugar, blood glucose dysregulation or imbalance. Let's kind of go through some of the root causes now for why someone has blood sugar issues.
Yes, really, the blood sugar can be imbalanced. The common one that we see, of course, can be like SAD diet, which stands for Standard American Diet, that maybe it's like too many carbs, too much sugar, and that really creates persistence, create resistance. So if we're constantly eating sugar, we're constantly eating carbs, where our insulin receptors become resistant, and we lose that ability to transform that glucose into energy. So that sugar, that glucose is just kind of circulating in our bloodstream and not being able to use that efficiently. So really, we don't want to be overeating the carbs and like constantly eating throughout the day. Ideally, wanting to like stick to our main meals. So that's one common one that we see. Maybe you want to address some of the others.
Definitely one of the things we always talk about is, is there a genetic component to blood sugar dysregulation? And there is, a lot of times people have a brother or sister or parents or someone, or grandparents that have blood sugar issues, whether it's diabetes or what's called pre-diabetes. There is definitely a genetic component, but as we know in functional medicine, your genetics are not your destiny.
Absolutely.
And we can take a SAD diet with one with ultra processed foods. And, actually, it's funny because I just, right before this podcast, saw this guy in a truck carrying this McDonald's, cardboard boxes, so which have Happy Meals, right? So it's like this idea of Happy Meals going to make you happy, but it'll actually make you potentially sad, from a health perspective because of that ultra processed food and blood sugar dysregulation.
Yes. And we also know that besides like affecting our insulin, our glucose levels with the food that we're eating, if we're constantly stressed and we're not sleeping well, that's also going to throw out the balance. It's going to increase our cortisol, which is that stress hormone, which is going to disrupt our sleep, and it's going to make our insulin levels also go higher, which is going to dysregulate the blood sugar in our system as well. So from a lifestyle perspective, really focusing on stress management and sleep can be really big. And we have a sleep episode coming up, so that'll be good.
I'm excited about that. And love functional medicine because it is very broad in terms of the root causes. We know that most issues, including blood sugar, and that's not any exception, do have multiple causes, and they synergistically work together to cause either health issues or, in the case of reversing that, actually health promotion. So environmental toxins is actually a big cause of blood sugar dysregulation as well.
Yes, the toxins themselves can damage those receptors.
So basically, toxins and toxic exposure to the cells and cell membranes cause insulin resistance.
Yes.
So I love to say about insulin is an escort for glucose, right? Like if you are listening to this and you ever went to a dance with someone or a prom with someone, insulin is escorting that glucose into the cell. But just imagine going to that prom or that party and going on your outing, but you are knocking on the door to that cell trying to escort that sugar into the doorway of the cell, but then the door was locked.
Right.
That's what happens with toxins.
Yes, absolutely. And we need that insulin to be functioning optimally to be able to open that door and really go in and do what it's supposed to do to give us more energy. But on the other hand, if the door is closed, then it's just going to make us more fatigued and feel worse, more brain fog, and feel less optimally.
So all these things, SAD diet, genetics, stress, sleep, environmental toxins, all make the door harder to open when we're talking about getting the blood sugar in and basically what's called insulin sensitivity, which is basically getting the blood sugar in an efficient way through that doorway so that we can live optimal lives and have optimal blood sugar balance. Last but not least, we're talking about hormone imbalances. The hormones are really, really crucial for balancing blood sugar.
Yes, and we touched a bit with the like cortisol and insulin balance, but of course there's other hormones that can play a role in it as well. And with that, we also see that keeping like our strong, our muscles strong and keeping a good muscle mass is going to be helpful for keeping like testosterone levels up and keep the metabolism of the glucose in our muscles as well. So yeah, I think those two tie together.
Absolutely. So in terms of hormones, we're talking about estrogen, testosterone, DHEA, which is an adrenal hormone, but also thyroid. Thyroid's a big part. And we see a lot of people with thyroid issues in our practice that maybe have previously been undiagnosed, really.
Mhm.
So we can get into a deep dive now on dietary nutrition a bit because again, we want to kind of change that sad diet to a glad diet. We haven't thought of a mnemonic for that, but I'm sure we'll work on that.
Yeah.
Welcome back to Know Your Body. I'm Dr. Andrew Wong, alongside our Director of Functional Nutrition at Capital Integrative Health, Araceli Benavides. Earlier, we discussed the many reasons you might have trouble with optimizing your blood sugar. Now let's talk about how we at Capital Integrative Health find out the root causes of blood sugar dysregulation and what steps we can take together to address it.
Thank you. Yeah, so earlier, Dr. Wong, you referred to the blood sugar as a roller coaster, and I totally agree. And I feel like I use this a lot with my patients. Like we really want these to be as stable and the fluctuations to be small throughout the day. So really to keep that roller coaster as stable as possible throughout the day is really important to start even with sleep, like optimizing the sleep, which will go very in depth with a separate episode, but managing the sleep, making sure there's no sleep apnea so that cortisol levels and insulin levels are well regulated for how the blood sugar is going to behave throughout the day. And after we focus on the sleep, really the first thing that you eat during the day to break your fast, either if it is early in the morning or maybe you're doing intermittent fasting and you're eating like at lunchtime, doesn't matter exactly the time, but what you're eating to break your fast is going to be really important to prevent that roller coaster. If you're eating like first thing in the morning, like cereal with added sugars and then fruit juice, and it's going to create a huge spike, then it's going to make you crave more food, crave more carbs and sugars throughout the day. But on the other hand, if you're prioritizing protein like eggs and maybe you're adding healthy fats like avocado, let's say an omelet with avocado, and you're not having much carbs, or maybe you do like fruit at the end, some like berries at the end of your breakfast, you're not going to create a glucose spike and you're going to get maintain your blood sugar very stable. And that's going to keep you satiated for longer. You're not going to be craving so much food, and you're going to feel more energized. You're going to set your day, the rest of the day, to be better for how you feel. So I feel like that first meal of the day is one of the really key things for blood sugar regulation.
So you're saying you're starting to break the fast with specific macronutrients, specifically maybe fiber, proteins, fats, and avoiding carbs in that first bites because that's going to start that roller coaster.
Yes, or if we do some of the carbs, trying to do it at the end of the meal when we're already digesting the fiber, we're digesting the protein, the fats, and then the carbs are going to absorb much slower, which that also applies to the other meals that we do, like the order in which we're eating them is very important. And I do really refer with my patients to the graphics that the glucose goddess uses. And if you're interested in that, definitely check out her social media. She has a lot of educational things that will visualize like how that affects when you eat foods in the right order, starting with the main meal. If you do vegetables first, that's going to give you that like fiber, like a nice like cushion to slow down the starch like breakdown, and then some protein, fats, and at the end the carbs. It could be maybe sweet potato or quinoa or any kinds of carbs that you're having with that meal.
Sounds delicious. I love that breakfast. Let's talk about what carbohydrates are in terms of what kind of foods, because I think one of the things that people may not realize, especially when we're listening to nutrition or they're going to Dr. Google and trying to figure out, well, I eat healthy, I eat oatmeal every day, or I eat cereal every day. What are some carbohydrates that, if they're eaten sort of quote unquote unopposed with, or not in combination with proteins and fats, what are some carbs that might spike someone's blood sugar if they're eaten first?
Yes, and this can be a wide variety of carbs because it could be simple carbs, like things that would have sugar, or refined carbs, things that will be like flour or like white rice. And those will really, because they've been like refined, all the like fiber and like nutrients have been like taken away, those can be absorbed like really fast. So if we just eat them directly, we digest them and we really spike our blood sugar really fast. And so on the other hand, we can use more like complex carbs that will have more fiber, some other nutrients, like I mentioned, maybe like quinoa or even like sweet potato would be like better like options. And especially if you combine them with some other vegetables too.
So on a SAD diet or standard American diet, eating quinoa or sweet potato is not standard for a diet, but we're trying to live an extraordinary lives, right? In terms of blood sugar, not ordinary. So what would you say to someone that said, well, I like to eat, my flour in the morning, or I like to eat my cereal in the morning, and that's just what I am used to.
Yes, I think that starting with like small changes at a time. So I typically tell my patients, even if you start with just one meal and maybe starting with the first one during the day where you make adjustments is going to help you a lot with like what you're going to be craving for the rest of the day. And then helping, even if they know they're going to have something, maybe there's a celebration or something like they know they're going to have cake or they know they're going to have something with sugar. There's different hacks that can be used to like minimize the blood sugar effect, maybe using the apple cider vinegar hack. So diluting 1 tablespoon of apple cider vinegar in a full glass of water and drinking that first before you're going to have the like carbohydrate. And that in research have shown that it can decrease the glucose curve by about like 30%. And so doing that and maybe adding some movement after that carbohydrate to get your muscles using more of that glucose as energy, that itself can help like stabilize it a little more. So yes, we want to be making changes in our diet and switching like the more like empty calories and simple carbs to more like nutritious and anti-inflammatory types of foods. But also there's like wiggle room to be able to use some hacks to regulate the blood sugar, even when we're eating something that might not be the best option.
So I think it's time for some functional medicine story time. You hit
Yeah.
on something really key, Araceli, which is an anti-inflammatory diet. And let's just take a patient case because I think people listening up there, well, why should I regulate my blood sugar? It's going to look really good on the CGM, the continuous glucose monitor. It's going to really look good. My doctor practitioner is like looking at my labs, patting me on my back. But why does that matter for my health? So I think just telling some stories about, some patients where they have, blood sugar issues and they don't even know they have blood sugar issues. They have that sugar rush, they have that inflammation. And inflammation is one of the root causes of chronic disease, as we know. And it can cause many things, including heart disease and dementia and strokes, but also things that are chronic, including depression, anxiety, and even osteoarthritis. So I just want to mention that, for instance, early in my career, I had a 80-year-old man coming in with joint pain all over his body. He hurt everywhere. He couldn't walk that well, couldn't walk upstairs, couldn't carry his groceries. And I asked him what he was eating. And we're talking about blood sugar. And this is before we had amazing nutritionists like yourself here. And I said, well, what are you eating? What are you drinking? He said, well, I'm having cereal for breakfast. I'm having Coca-Cola a couple times a day. Again, apologies, not really to Coca-Cola. But, so he was eating a lot of carbohydrates throughout the day, and his joints and muscles and tendons were inflamed from that blood sugar, right? So he couldn't move very well because of that inflammation. His body was literally on fire, essentially, or metaphorically. So after 30 days of going off of blood sugar, raising foods, which are the refined carbohydrates and sodas that you're talking about, his arthritis, his joint pain, his tendon pain, muscle pain all went away. It went away, and this is an 80-year-old guy. It's never too late.
Yeah, absolutely. Yes, I'm thinking of a patient as well with common concerns about like fatigue and like weight gain. And really finding this like regulation of the blood sugar helped so much to like regulate the amount of hunger, the satiety, like regulation, helping to like make better choices on the meals and increase like energy and like weight management. So it really can have such a broad effect from like improving pain, improving sleep, improving energy, weight management. So a lot of reasons why focus on blood sugar regulation.
And just to piggyback on what you said about energy, regulating the blood sugar better is going to help fix someone's fatigue or solve their fatigue. We talked about that in the first podcast episode. How do we get more energy into our cells? How do we activate the batteries, which are called mitochondria in the cells? And blood sugar regulation is a big way to actually do that.
Yes, absolutely.
So let's go into movement. I know that's something that we both are really into, exercise, and I'm trying to get as fit as you. But how do we help with increasing muscle mass? How is movement before or after meals really helpful in regulating blood sugar?
Yes, a couple key recommendations around this topic. One simple one can be adding 10 minutes of movement after a meal. And even if you just do this once a day, and it can be something that you have to do anyway, like movement around your like work or house, or if you can take a walk around the block after you ate, that's going to help a lot of that, like utilizing the glucose as energy. And then overall working on like strength training, like weightlifting and having more muscle mass to keep this going, like even when you're not exercising, because the muscle mass is like our largest organ that's going to be using this glucose as energy. So really staying strong can be super important for blood sugar regulation.
Especially the quadriceps, the quads. That's
Yes.
what, sometimes joking thunder thighs or something like that, just trying to increase the quadriceps. That's going to be really helpful to help with blood sugar regulation. And then also with movement, the other thing I'd like to say is, it's kind of like a super immunity cape or something, or super insulin sensitivity cape when you exercise. And I know that, one of the things that's interesting from studies is that when you exercise, you are insulin sensitive, meaning you're going to be able to handle blood sugar more effectively up to 24 to 48 hours after exercise for that whole period.
Yes.
Which is amazing.
That's very powerful. So yeah, we discussed about the food that we're eating, the movement, the kinds of movement we're doing. And I think I know we touched a little bit on the root causes about the sleep and the stress. So maybe you want to touch on some like key recommendations for that.
For sleep, I think the biggest thing is so many people do have what's called sleep apnea. That's an undiagnosed condition a lot of times where people can't get enough oxygen at night because of anatomic issues or because of metabolic issues. But sleep apnea is something you can talk to your practitioner about. They can do a home sleep or in-lab sleep study. But aside from that, so many people have what's called chronic insomnia, just trouble sleeping, and their hormones are imbalanced. They have insulin resistance. They have too high of cortisol. And that's going to affect their blood sugar regulation, because when we don't get enough sleep, we don't handle blood sugar as well, especially less than 6 hours of sleep. So improving the sleep quality, which we're going to talk about in our next episode, actually, is really, really important for sleep. Are there any foods, or are there any other ways, if we talk about blood sugar regulation, how does blood sugar regulation affect, the ability to sleep well? Because we did talk about how, sleeping not that well affects blood sugar, but how does blood sugar affect sleep?
Yeah, so when our insulin levels are too high at night, that can also affect the production of melatonin. So we want to kind of ideally not eat like 2 to 3 hours before we go to bed. And definitely for giving that, we mentioned how like eating too often and too much can disrupt our insulin sensitivity. So also giving our body a break. So maybe doing some intermittent fasting, like fast at least 12 hours while you're like sleeping. It could go up to like 12 to 16 hours, is going to help recover that sensitivity to the insulin, and help like how we metabolize the glucose. So that's something we can consider incorporating intermittent fasting and meal spacing, like focusing on the main meals and not snacking in between.
The intermittent fasting, that's almost like another podcast episode.
Yes.
That's really, really important, though, for training our bodies to actually be able to fast, because a lot of people, when they're trying to sleep, they wake up hungry because their blood sugar is dysregulated and the blood sugar drops, so then they wake up.
Yes, absolutely. And I think just a couple more recommendations that we have. I guess one that is, we'll just touch on brief because it's a whole like episode on itself, but the environmental toxins that we mentioned, there's like different toxics like arsenic and phthalates and microplastics like BPA that can damage those receptors as well. So further looking into that with your practitioner, see if that's like a possibility that might be affecting your blood sugar, especially if you feel like you're doing the right lifestyle recommendations, you're sleeping well, you're managing your stress, you're eating well, and still your labs come back with dysregulated blood sugar, pre-diabetes, and you don't really understand why. Looking into toxins can be another piece of the puzzle that needs to be addressed. So doing some like working on detox, having like daily bowel movements, having good levels of fiber, hydration, sweating, like all of those great things that our body can do to help us detox. And we should probably mention in some really key like nutraceuticals that can be helpful when we're having issues with blood sugar regulation.
Yes, absolutely. So one thing that we know is that a lot of the micronutrients are kind of like, they allow the body to process blood sugar much more easily, so we can have a great diet, but we need to have the micronutrients, the vitamins, minerals, and antioxidants that are really helpful to kind of ease the passage of that insulin and make that insulin more, more an effective escort, so to speak, to get that blood sugar into the cell. What are some of those supplements and nutrients that can help with blood sugar regulation?
I really love the combination of berberine with alpha-lipoic acid and inositol. I find that those, in my experience with my patients, have been the most effective to bring it down. We definitely use like personalized dosages depending on what's the level of like blood sugar that we're dealing. But I personally like those together. Do you have any preference, Dr. Wong?
I like those too, Araceli, and I would also add some of the minerals that are depleted, especially with stress.
Yes.
Things like magnesium and zinc are very important for blood sugar regulation. So I'll check those usually on labs and make sure that they're optimized as well. We talked about chromium picolinate as well. That can be very helpful for
Yes.
people.
And there's really good blends out there that include some of these nutrients together.
So just in summary, we can talk about what are ways that we can optimize our blood sugar. We talked about things like dietary and nutritional interventions, lowering the glycemic index, a lower carb diet, starting out the day with some protein, kind of the order of meals, proteins, fats, fiber, anything else with nutrition.
The intermittent fasting and
The
the meal
intermittent fasting
spacing.
and meal spacing. Intermittent fasting, you would start with 12 hours of a sort of a feeding window or eating window, and then 12 hours of fasting.
Yes,
Okay.
and using maybe the apple cider before the heavier like carb meals.
Okay. With water, right?
Yes,
So,
always diluted. If not, it can be very strong for the esophagus.
yeah, it's a bit sour.
Yes.
Yeah. And then movement, talked about increasing muscle mass by working on strength training and also movement before and after meals.
Yes.
Environmental toxins. Unfortunately, we live in a toxic world, but having ways to really mitigate that by regular sweating, especially because sweat is one of the only ways we can detox plastics and phthalates.
Yes.
But also some of the nutrients that can help with detox that are found in food, the green leafy vegetables, the cruciferous vegetables, things like broccoli, cauliflower, kale,
Yes.
things like that.
Broccoli sprouts and celery and beets can be super supportive for the liver as well.
Okay. And then sleep, what are kind of some of the takeaways there?
Prioritizing at least 7 hours of sleep to be able to like lower that cortisol and improve the insulin sensitivity.
We didn't talk about EMFs, but electromagnetic fields can be very harmful actually in terms of even blood sugar regulation. I think there's an issue with activating the fight or flight response, activating that kind of sympathetic or fight or flight response that then elevates the cortisol, that then elevates the insulin and leads to insulin resistance. So there is actually a thought about there's psychological stress, there's physical stress. So really working on stress management is very helpful here too.
Yes, and we'll have a whole like sleep episode and we can probably do a whole stress.
I think
episode.
so. I think so. So there's a lot of also what's called emotional eating, right? A lot of people know that, eating a whole bag of chocolate chip cookies is not good for someone, but if they're having a rough day or whatnot, maybe it's easy to reach in that bag and comfort themselves. So there's a lot of, importance of, stress management and being resilient and being able to handle that stress that would actually affect blood sugar. And then you mentioned kind of options to use a continuous glucose monitor as ways to optimize and try to understand what's happening with someone's blood sugar, even if they don't have, diabetes or something. What kind of ranges are we talking about there?
Yeah, that's a great like immediate feedback. So you can see, as I mentioned previously, like 70 to 90 as like fasting glucose would be ideal. And then after you eat, you can see what effect that had on your blood sugar. If it's going higher than 30 points, that was like too much and that's still creating like a glucose spike. So you can try different amounts, maybe like cutting back on the amount of the carbohydrate that you're eating, or trying like the vegetables first or moving afterwards to see if you can keep your blood sugar stable. And that's something that my patients, when they use it, it's very eye-opening, and they can find like certain foods that they didn't expect that were like causing a negative effect that they are, and like switching those changes. Maybe they say like, I can handle half a cup of cooked like brown rice, but I cannot do more than that. That would spike my blood sugar. So you really learn like what works for your body and what doesn't, because each body is different. So we might have like different things that work for each of us. So that's a great tool to have. And so the ranges for like non-diabetic patients, we recommend staying in the window of like 70 to 140. And for diabetic patients, we can do like more 70 to up to 170 or 180.
And then supplements or nutrients, because we all need a boost there.
Yes.
Berberine, you mentioned berberine and alpha-lipoic acid and inositol, chromium, and those are some of the big ones, the main ones. Okay, great. Well, Thank you so much. And I think, we are really talking about, blood sugar regulation and how important this is. And thank you so much for joining us on Know Your Body. And we'll be back next week and every week to talk to you about your health and how you can achieve the body, mind, and spirit that you want.
Thank you.
If you want to learn more about Capital Integrative Health, check out our website at cihealth.org. Thank you so much for listening.